So I came across one side effect of corticosteroids because I was reading about all those inflammatory conditions in orthopedics, right? That's why I'm actually still discussing it under orthopedics, but it's kind of like pharmacology too, you know. So I was reading about corticosteroids, how they are used to actually reduce all those inflammation and the rest of it. So I read about one of their side effects is they could actually cause infections. So I was now saying, okay, let me research more on this and look at it step by step to how this infection comes in when you are taking a drug that happens to be a valuable drug. So how corticosteroid drugs increase risks of you having more infections, you know. So just so you know, they can increase the risk of infection, and the summary there is what? They suppress the immune system. But we have to now look at step by step. What do they do to suppress the immune system? Okay. So the first thing here is what? They decrease the levels of what? White blood cell, how they work. Like they'll decrease how much your white blood cell is working. So corticosteroids so that they impair the activities of neutrophils or macrophages of lymphocytes, you know. And all these blood components are very important in destroying what? Microorganisms when they invade you. So they also decrease chemotaxis. Chemotaxis is when the immune cells, if there's an infection, okay, for them to be able to locate where there's infection, there's a kind of like a chemical signaling that directs them to the place, okay. They also reduce what? Phagocytosis. This is when, you know, those blood cells engulf the microorganism and kill it, okay. So they suppress cytokine production too when you're taking corticosteroids. So they inhibit all those pro-inflammatory cytokines. They decrease antibody formation, okay. Decrease antibody formation. So barrier weakening. So they thin the skin and the mucous membrane. So it's now they can also make it very easy for microorganisms to get to you. They also impair what? Wound healing. You know. So this can prolong how long you have a particular wound, and of course a wound is like a gateway to infections. So dose and duration dependent. So higher doses and prolonged use will cause greater issues. Do you understand? Okay. So types of infections are usually common when you're taking corticosteroids. Include all those bacterial infections like pneumonia, cellulitis, urinary tract infections, okay, viral infection. That's basically even some viral infections are in you, but they are on the low key. They get activated, like herpes simplex, varicella zoster. Okay, fungal infection like oral thrush, systemic fungal infections. Okay, opportunistic pathogens. Okay, so this is what we got for how these corticosteroids are able to, you know, increase risks of you having more infections.